Hi, my name is Brianna Hardy, and this is my Nursing 602 Advanced Musculoskeletal Assessment. Let me pan around the room real quick. All right. We'll get started. Hi, my name is Brianna Hardy, and we're doing your Advanced Musculoskeletal Assessment, okay? All right, first we're going to start with your hands and wrists to assess for carpal tunnel. We'll get you to do the phalanx test, which looks like a reverse prayer. Push your wrists together, good. You can put your arms down. We would normally hold it for a minute, and after a minute, we would ask if there was any pain or tingling in the thumb, pointer finger, or index finger, and the middle finger, both there. Yeah. Okay, and that would indicate a positive test. Next would be the Tinel's test. Percuss over the median nerve. Any pain or tingling? No. In the same 3 fingers. All right. Same thing? No. Okay, and that is, positive test would be pain or tingling in the thumb, index finger, or middle finger. Next, I'm going to look at your elbow. We're only going to do one side from here on out. Normally, we would assess both sides for symmetry. All right, I'm looking for any redness, swelling, or deformity. I don't see any. I'm going to feel over the olecranon process, which is tip of your elbow and overlying bursa. Okay, I'm going to feel for the medial epicondyle and the lateral. No pain or, okay. Next, we're going to assess your range of motion. So I'm going to get you to flex, extend, pronate, and supinate. Good? No pain? All right. Next, we're doing your shoulder. I'm going to get you to remove your shirt for me real quick, please. All right. And again, only one side. First, looking to see any redness, swelling, or deformity. Next, my hands are cold. I'm palpate over the clavicle to the acromion process and the AC joint. All right. Next, we're looking at your range of motion. So I'm going to get you to do a forward flex, which is straight up. All right. Extension going behind you. Yep. All right. Bring it back up. We're going to abduct, which is going away from your body. That's ab with it, B. All right. And then across your body is adduction. Good. All right. Any pain with that? And we're also going to do internal rotation, external rotation. So internal, I'm going to get you to reach behind you, like you're going to scratch your neck, okay? And that's internal. And now external is going behind your back, and that's external rotation. All right, next we are going to look at your back and spine. So I'm going to get you to stand up for me. Have your back face the camera, please. All right. So we're looking for any deformity and his posture. He's got a normal curvature of his spine. We would assess for, we're looking at the shoulder blades for symmetry, and we're also assessing to see for scoliosis. So I'm going to get you to do a forward flex. So I'm going to get you to bend down and touch your toes. And here I'm looking at his shoulder blades for symmetry, which they are symmetrical. Uneven shoulder blades may indicate scoliosis. And his spine is straight. You may stand back up. Okay. All right. Next, I am going to palpate C7 and walk down. And during this, I would be feeling for the vertebral and paraspinous muscles for any tenderness or pain. Any? No. Okay. All right, and now we're doing your range of motion, which you just did forward flex. So now we're going to get you to extend. So do your back. Yep, good. All right. Next is rotation. So if you want to turn around and face the camera, you can. So you're going to keep your feet straight. You're going to turn your shoulders from one side to the other. All right. Good. And that's rotation. And now lateral bending, so you're going to stand straight and bend to one side with one arm and then to the other. Okay. And that's it for standing. Now I'm gonna get you to lay down so that we can do your special test for your back. Alrighty. So I'm gonna get you to dorsiflex. I'm gonna put pressure on your foot, and you're gonna pull your foot up, which is dorsiflexion. Okay. Good. And weakness with dorsiflexion could indicate a disc problem at L5 or S1. And now we're going to do your straight leg test. So straight leg test, and pull your leg up, and we go all the way up. And do you have any pain radiating down the back of your leg?
No.
Okay, and pain radiating down the back of the leg could indicate a disc problem. Alright, and that's it for our back exam. Now for your hip, let me get you to come over here with one of these. So for your hip, purpose of this exam, I'm not asking him to remove his shorts, but we would look for any redness, swelling, or deformity. And he has no complaints of hip pain. We're going to do your range of motion exercises now, okay? So with your leg completely straight, don't bend your knee, raise your leg up for me. Good. And that is flexion. You can put it back down. I'm going to get you to roll to your belly for me. With that same leg straight, don't bend your knee, raise it up. And that's extension. Okay. You can roll back over. Alright. We've got internal and external rotation. So I'm going to get you to bend your knee up. And, yep. And now internal rotation. So you're going to put your knee towards your other leg. Good. And external rotation, let that knee drop out. Good. Alright. You can straighten out your leg. The last two are abduction and adduction. So abduction, you're going to take this leg away from your body. Yep, good. And adduction, you're going to go across that other leg. Good. Alright. And that's all those range of motion exercises. There's any pain with them?
No.
Good. Alright. Last is your knee. So we first look, inspect, and see if there was any redness, swelling, deformity. Feel the patella and patella tendon, the tibial tuberosity, the medial line joint, the lateral line joint, and I'm also feeling the posterior fossa for any firmness or swelling, which could indicate a Baker's cyst. Didn't feel any. Alright, we've got all these special tests to do for your knee. So the first one we're going to do is the blockment. So quickly do this. And if there was any spongy feel, we would suspect effusion, which there was none. Next is varus and valgus. So varus is testing to see if there's any LCL injury. Any pain?
No.
Okay. And then the valgus, same thing, is testing to see if there's any MCL injury.
No.
Okay. All right. Next, we have the drawer test. So anterior drawer and posterior drawer. So I'm going to get you to bend your knee up for me. Good. All right. And I'm going to place my hands behind your knee and push in. Any pain? Okay. Pain or give with the anterior drawer test would indicate a positive test and could indicate a ACL injury. So same thing, placing my hands here, but I'm going to pull forward instead. Any pain?
No.
Okay, and pain and give with the posterior drawer test may indicate PCL injury. Alright, next I'm going to actually lift your leg up. Okay, and this is called the Lockman's test. So I'm going to push down on your femur and your tibia. Any pain?
No.
Okay, you can put your leg down. And that is also a positive test would indicate an ACL injury. The last test is the McMurray's test to test for meniscal injuries. So I'm going to get you to actually fully flex your knee. Good. I'm gonna put my hand to the side, get your foot so I can control it. So we're gonna externally rotate and come out straight. Any pain?
No.
Okay. And same thing. We're gonna internally rotate, come out straight, and go. Any pain?
No.
Okay. Pain in the joint line or hearing like a clunk or crack may indicate a meniscal injury. And that concludes our assessment. Thank you.